Hello, thank you all for joining us today at our webinar, The Role of a Clinically Studied Herbal Supplement in Helping Individuals Who Suffer from Overactive Bladder on Scia Pro. Presenting today are Dr. Lilja Kjalarsdóttir, CEO of Saganathura, and I am Páll Hauksson, Head of Research and Development at Saganathura.
Should we maybe tell our attendees a little bit what's going on right now in Iceland?
Oh yeah, we might want to mention that.
Might happen.
Oh yeah, definitely. So we've had some seismic activity here and close to us. We're actually expecting a volcanic eruption about 14 kilometers away from where we are right now. We've had some very strong signals from earthquake monitoring that we might have an eruption quite soon. And I guess we'll have to wait and see what happens, but hopefully we'll be able to finish this seminar before running to safety.
Yeah, so we might actually experience some earthquakes during this webinar. We have actually been experiencing several strong ones over the past few days. Well, it's been almost a week now.
Yeah.
So pretty exciting. We are not in any danger though, so don't worry about us. We are not expecting a dangerous volcanic eruption at this time. And but yeah, exactly. So maybe something to remember this webinar by.
Yeah. We'll see.
So should we just go into introductions and get going?
Yeah, I think so.
Mm-hmm. So my name is Lilja Kellerstadt. I have a PhD in biomedicine. I have a broad background in studying, developing, and selling nutritional supplements. I've been in this industry since 2014 full-time, but I have been kind of a nut about supplements since I remember myself. I did my PhD in UT Southwestern in Dallas, Texas, where I was studying vitamin D and insulin secretion, and then I did my postdoc at Duke University. I moved back to Iceland in 2014 to join the biotech company Remedies, where I was studying and launched products as chitosan products, actually, both as supplements and medical devices. And we were studying also some inflammation, and so a lot of fun stuff there. Then I joined Saganathura as COO, and I took over as CEO last February of last year. So it's been a year now. So that's me, and maybe Páll will give us a little introduction.
Mm-hmm. I will. So I'm Páll Hauksson. You can call me Páll. I have a background in food processing and food product development. I gained my master's degree in food science in 2016, and my research focus has been on food processing, stability, and consumer research. As head of R&D at Saganathura, my main responsibilities have been microalgae and Angelica processing development, product development, stability and bioavailability studies, consumer research, and export sales account management. A little bit about Saganathura, the company. Our vision is to improve the health and well-being of people all around the world. And our mission is to use biotechnology methods to harness the power of nature and create unique health products. Saganathura focuses on two key ingredients, astaxanthin and Angelica archangelica. Saganathura cultivates microalgae using sustainable energy and offers astaxanthin as ingredients, both finished products and private label products. Saganathura also manufactures extracts from Angelica archangelica, used mainly for Scia Pro, our popular bladder health supplement, and Vox's throat lozenges. Now, as for the webinar, we want to ask you to send your questions through the chat or as a direct message to the webinar host at any time during the presentation, and we will address them at the end of the presentation. So I guess we should now just dive into matters related to overactive bladder.
Yeah, absolutely, and bladder health. So it's always fun to start with a little bit of statistics. we see that these are numbers from the USA. As much as 75% of older men and women that are over 70 void during the night 1 time or more. So this is called nocturia. Many people relate this to the elderly, but we can also see, and this graph shows, that this is also an issue for the younger adults. So up to 20 to 30% of young adults void one time or more during the night. So this absolutely is some issue in population of all ages. So for women, there's the most common problems we see is stress incontinence, the overactive bladder, and cystitis caused by infection. In men, we see urinary retention, incontinence, overactive bladder, and benign prostatic hyperplasia, where you have enlargement of the prostate that presses on the bladder, which causes the urge to urinate. But today, we are not really going to be focusing on the prostate. We are going to be talking about the overactive bladder. So overactive bladder affects about 10% of adults, over 10% of really the whole population. It increases in prevalence with age. It's actually a similar rate in men and women, although men tend to develop symptoms a little bit later in life. The cause of overactive bladder is actually a disruption in nerve signals between the brain and the bladder, which alerts the bladder to empty when it really shouldn't be alerted to empty. So this is kind of what we call like irritated bladder or an overactive bladder. So for some of the common symptoms of overactive bladder, there is the feeling of a certain urge to urinate, experiencing incontinence or unintentional loss of urine, frequent urination, normally more than 8 times in 24 hours. So that's kind of the cutoff for an overactive bladder. And then, of course, nocturia, which is defined by the need to wake up 1 or more times during the night to void. So for some of the facts about OAB, OAB increases risk of falling. This actually increases risk for elderly to break bones. And we see that a lot of nursing homes here in Iceland purchase Scia Pro in bulk for the people that are dwelling in these homes to actually minimize the risk of falling, because this normally happens when people are disoriented when they're waking up during the night to go to the bathroom. Then, of course, we see that people with OAB have severely diminished quality of sleep because they have to wake up pretty frequently during the night. Some people that I've talked to, actually a lot of them, have been able to reduce their nighttime urination from up to 8 times down to 2 times by using Scia Pro. So you can imagine, having to wake up 8 times during the night, you're not going to get really quality sleep. And with this, there's also some mental health issues, because about 30% of people with OAB suffer from depression, and about 50% suffer from anxiety. And this is caused by anxiety from not knowing. For example, if you're going on a trip or a hike, you're worried about finding a bathroom. So this also has some social impact also. This often goes undiagnosed because people assume that this is a natural part of the aging process. However, more people right now know that this could be treated, and this can be treated. Like I said earlier, it increases in prevalence with age, more common in patients over 40 years of age. However, also young people suffer from OAB. About 600 million people worldwide could utilize or could benefit from getting some kind of a treatment for the overactive bladder. And as I told earlier, men develop these symptoms later, a little bit later in life in general than women. So for some of the risk factors, since OAB is a neurological issue, some of the risk factor includes nerve damage caused, for example, by abdominal trauma, pelvic trauma, or surgery. Pelvic stones are also a risk factor. Some drugs have this side effect to increase the symptoms of OAB. And then you have the neurological diseases, including MS, Parkinson's, stroke, spinal cord lesions. We actually have a lot of people with MS buying Scia Pro here in Iceland. Then, of course, there's bladder or prostate cancer, and then urinary tract infection, which is caused by inflammation, which causes inflammation of the bladder and results in symptoms of OAB. So for some of the treatments, there is the preventative or lifestyle actions. There are pharmaceuticals, and then there are natural remedies. However, there's really no definitive solution to cure OAB, and there's no really a single pharmaceutical or natural solution that fits the need of every patient. So people often have to try several different solutions to figure out a solution for their problem. So if you just go over some of the ways that people can use lifestyle changes as a preventative measure, it is recommended to maintain a healthy weight, actually exercise on a regular basis, limit caffeine and alcohol, especially before nighttime. Well, I guess you don't want to be drinking in the morning though. Quit smoking, and then managing chronic conditions such as diabetes. And then, of course, the famous Kegel exercises. However, all of these can be helpful tools and should be utilized, but the adherence rate is not maybe the best in the world. And then we have pharmaceuticals. A lot of these are anticholinergic drugs, which actually block the action of acetylcholine, which is a really important chemical messenger. So this does prevent the contraction of the bladder, but it can cause and does cause a lot of severe side effects for a lot of patients. So this really limits the adherence, and there's actually a significant or majority of the patients have dropped out of treatment by the end of the first year. So some of the common side effects from pharmaceuticals would be, for example, from these pharmaceuticals that are used for overactive bladder would be dry mouth, nausea, disorientation, constipation, and even as for some of the worst side effects would be cognitive impairment, because acetylcholine is a really important messenger and is important for proper brain health. Patient dropout is at high as 70 to 80% from some of these drugs. So it's necessary to find something a little bit better. There is actually a long history of use of that people with OAB symptoms seek natural remedies. Up to 75% of these patients do try alternative and natural solution at some point, either before they seek medical device or after an ineffective pharmaceutical treatment. There are several herbal medications on the market. Some of them have a long history, but in general, a lot of them lack proper clinical validation. Some of them do have clinical studies, but all of them actually lack further research. We will probably go over, Páll is going to go over some of these at the end of the talk. So really, there is an absolute need for a safe and effective solution to treat OAB that has limited side effects. This would also decrease healthcare expenditures around the world if we can find something that's actually working. So we have a solution for this, which has been working extremely well in Iceland. This is called Scia Pro. It's a natural treatment made from the Angelica, and we figured out, at first it came to the market in 2005, and we thought actually that it was working for to treat the prostate. It was mostly men that were using the product to begin with. However, after a really important clinical trial in 2012, we figured out that it was actually not affecting the prostate, but it was affecting the bladder. And this increased our, patient population by, increased it by, doubled it. We have about over 1% of the Icelandic population is using Scia Pro, which means that 1 in 10 that have some symptoms of overactive bladder are using Scia Pro on a daily basis in Iceland. So we hope that this can be the same case in other markets, and hopefully your markets also. That would actually be pretty fantastic. So to go over the clinical study that we performed in 2012, this was an 8-week study. It was performed on 69 men with nocturia. Now, this was any case nocturia, so it was a pretty broad patient population. This was a double-blind, placebo-controlled study, and patients received either placebo, or patients received either placebo or 200 milligrams of Scia Pro daily. And just to dive straight into the results, we actually saw an increase in the average nocturnal bladder volume for the subgroup with low bladder volume. This would be the group that has an overactive bladder. We did not see this increase in average nocturnal bladder, for example, for men with that only suffered from benign prostatic hyperplasia. The Scia Pro group increased their bladder volume by 44 milliliter, going from 260 to 300 milliliters that they were able to store in their bladder on average. We also saw, and this is even more important result, we saw that the Scia Pro group decreased their nighttime urinations by 1.5, and this is going to increase the sleep quality significantly. The placebo-controlled was able to decrease their nighttime voiding by less than 1 time per night. Again, this is in the subgroup that had an overactive bladder, so this was an extremely important study because this kind of led us down the right track of studying Scia Pro and the method of action. But because by this time, Scia Pro had been on the market since 2007 and since 2005 for 7 years, and was actually pretty popular at this time already. So with this, we were able to do some new studies and start looking at the bladder model. Now, this is probably the most complicated slide I'm going to be showing to you, but please bear with me. So we have a lot of beneficial compounds present in Angelica. And I would like to say that, we are world champions in Angelica research. Wouldn't you say so?
Yeah.
Yeah.
No question.
No questions. No question about it. So what we've done is that we have actually isolated and fractionated every single compound in our extract. We've taken these isolated compounds and we've tested them one by one in a bladder contraction model. And then that's actually one of the results from our many studies. You can see here in the figure, where we actually are looking at bladder contraction and bladder relaxation. Now, the graph above is from a condition where we added CO8, which is a compound that we have identified to be a pretty significant effector on the relaxation properties of Scia Pro, and is actually a really interesting compound. It's really little studies about this compound before, so we are pretty excited about finding something so unique. And it's actually pretty unique to also the Angelica. So what we see is that when we add CO8 to our bladder muscle, we see that when we add CO8, we see no relaxation immediately, which is good because it's not a pharmaceutical compound. It's not directly activating a receptor to relax the bladder. But when you have the natural signal, epinephrine, that naturally relaxes the bladder, we can enhance the natural relaxation process of the body. And that's why Scia Pro is so fantastic. Maybe I can show. So how can I do the pointer? Can you help me?
Yeah, I'll help you out here. Hold on. Almost there. Spotlight.
All right. Okay. Okay. This is actually better. Now I can explain. Okay. So this is where the bladder is contracting, and we can actually add compounds to let the bladder contract. And this is with CO8, and this is without CO8. So here we add CO8. You see, there's no relaxation of the bladder. Relaxation would be the graph going down or the line going down. And when we add epinephrine, we can see the relaxation of the bladder. Now, normally we have desensitization, so you can actually get relaxation and then it goes back up and the bladder contracts again. But when we have the CO8 present, it actually elongates the relaxation properties of epinephrine. So this is actually really fantastic because it's affecting the natural process of the bladder. Should I stop the spotlight? Just move it. So I hope this was helpful to include the spotlight to explain this a little bit better.
I think it was.
Okay, fantastic. All right, and we are happy to say that we have now a patent pending for the use of Scia Pro as a solution for an overactive bladder. Where we have included the treatment, utilizing the treatment of CO8 to treat overactive bladder. So we're really hoping that this is going to go smoothly. We've actually been pretty good at getting patents through. So I'm really optimistic about this. And then maybe to go over some of the current projects that we have ongoing. I would like to turn the mic over to Páll, Arnar, or Palli, or Páll. Well, Páll, yeah. Palli in Icelandic.
Yeah. Thank you, Lilja. So in May 2019, Saganathura received a grant from the European Commission for a 2.2 million euro project to take Scia Pro to the next level. And we will do that by standardizing active compounds, optimize production, and prepare for scale-up to deal with increased demand. A part of this project will be the selective breeding of Angelica plants to maximize the CO8 content and prepare for Angelica field cultivation. A large part of this project is a clinical study that is currently underway, and I will go into more details on that on the next slide. I want to tell you also that we have now been able to increase the CO8 content of our extract quite significantly from using the knowledge we've accumulated over the past few years. Now, here are some details about our clinical study that is a part of this project I mentioned. We are now recruiting 200 apparently healthy subjects, 100 women, 100 men. And this will be a double-blind, placebo-controlled study. The participants or patients included will be those that are suspected or have already been diagnosed with overactive bladder. And we define that as people with an average of over 1.5 nocturnal voids per night and or less than 2 hours between voids at least half the time of the day. The age of the participants will be between 30 to 70 years of age. And the primary outcome we're looking at is the reduction of urinary frequency. That is the number of voids in 24 hours. We will also look at as secondary outcomes, number of daytime voids and number of nocturnal voids, number of voids occurring shortly after the last one, and improvement of the results of the ICIQ-LUTS scale, which includes a quality of life assessment. Now the intervention will be 7 weeks, 1 leveling week, and then 6 weeks of intervention. The follow-up will be 3 weeks, and we will monitor the maintenance of a number of urinations as in post-intervention. And in our experience, our experience is that once people stop using Scia Pro, the symptoms reappear and become worse once again. I would like to tell you a little bit about the source of the ingredient. Where are we? Well, we are in Iceland, and Saganathura believes in preserving and fostering the Icelandic nature. We use a sustainable and eco-friendly production process that protects the Icelandic environment. Angelica is harvested wild in a small island in the north of Iceland, so that would be here up on top where the red marker is showing. This is where we harvest our Angelica currently, but the plant itself is quite abundant in all of Iceland, and you could find this almost anywhere.
Maybe to add, I mean, because we have pretty nice maps. Our chief scientist, Angelica scientist, has been working on Angelica for 20 years. He has actually gone all over Iceland to map out the CO8 content of the Angelica. It's pretty. He's Angelica, the Angelica master. So and we see that, and this is actually why we chose the Angelica in Hrísey. Just like
exactly right.
Yeah.
Very interesting research. So the harvesting of Angelica is done by hand and takes place during a 6-week window each summer. And during this time, the sun never actually sets. So it's going to be bright, 24 hours, a good time to be outside in nature and cut some Angelica leaves.
Yeah, we do let people sleep though, right?
Yes, we do. So each year, a member of the management team visits the island and inspects the quality of the harvest. And you can see on the right here, Lilja is inspecting the harvest in a nice summer day in 2018.
Yeah.
You remember this?
Yeah, I remember. Good quality leaves.
Yeah.
Fantastic day.
Great. So why do we think the OAB market is ready for Scia Pro? According to the World Health Organization, approximately 80% of the world's population has used at least once some kind of alternative medicine. The global herbal supplement market is expected to reach $86.7 billion in 2022, and the overactive therapeutics market is poised to grow by $311 million in the US alone by 2024. As these numbers indicate, the market for OAB solutions doesn't appear to be declining anytime soon. Along with individuals who suffer from OAB, healthcare providers and other healthcare entities that make up the medical community can benefit from the advantages Scia Pro offers. I'd like to go over some frequently asked questions. One of them is Angelica the same as Dong Quai, which is actually Angelica sinensis? Now, this plant is indigenous to China and is most commonly recommended for women's health concerns such as PMS, menstruation, and low energy. On the other hand, Angelica arch Angelica is indigenous to Scandinavia, Greenland, and Iceland, and is recommended for bladder concerns specifically. Another ingredient commonly seen in supplements related to urinary issues is saw palmetto. This is a plant that is indigenous to the United States and is most commonly recommended for benign prostate hyperplasia and prostate concerns. Now, Palmetto is thought to inhibit testosterone's effects on prostate cells. And on the other hand, Angelica has no hormonal effects that are known. So, how to use Scia Pro? The standard formulation that we use for Scia Pro is formulated with clean label excipients, and they come in small size 1 capsules. We recommend to our customers to start with 200 milligrams or 2 capsules per day for 14 days, and then reduce the amount to 100 milligrams daily. If our customers feel that some of the symptoms reappear, we recommend that they continue taking or increase the dosage again up to 200 milligrams. We recommend for daytime bladder problems to take Scia Pro in the morning, and for nocturia and nighttime bladder problems, we recommend taking Scia Pro before bed. We have not observed any significant adverse effects related to using Scia Pro.
Which is really important, because this is one of the biggest issues people have.
Yeah. We don't like side effects.
No.
Now, we have received countless testimonials from our customers, and we really appreciate hearing from them, and we'd love to share their stories with you shortly. For example, here is one from a young woman that used Scia Pro to combat urinary urgency and nocturia. Another one is from an older male that successfully eliminated nocturia using Scia Pro, and one from a female that stopped going to the bathroom during the night and is no longer worried about reaching the bathroom in time. A 15-year-old boy reduced bedwetting incidents and had relief from the psychological effects it causes. A woman from the UK got relief from urgency, and a man combated nocturia and frequent daytime urination using Scia Pro. So this is the end of the presentation. We'd really like to thank you for listening. And if you haven't already, please send us your questions. We will start going over them right now.
So there is a question. Is the Angelica certified organic?
Yes, the ingredient is certified organic by an accreditation agency in Iceland called TUN, and the ingredient carries the EU organic leaf.
Do we have any other questions?
Let's see, I'm trying to open this here. Maybe it could be in the chat. Oh, here it is.
Okay, there is a question. Can children use Scia Pro? So yes, actually they can. We don't normally recommend Scia Pro. I mean, this is because we have our Scia Pro in the Icelandic market and control the marketing of Scia Pro in Iceland. So we normally don't recommend or advertise Scia Pro for kids. But we have actually a lot of concerned moms and dads that contact us, and because of the multitude of feedback and stories. Now, we don't have any clinical data for this, but we've had a lot of reports about kids that have this problem. And generally, when they're, maybe 4 or 5 years old and up to the 15-year-olds, the story that Páll said earlier, that have been able to benefit from using Scia Pro. Normally, kids don't have to then use Scia Pro for a pretty long time, because a lot of times it's psychological, and as soon as they've able to stop bedwetting, for a month or two, the problem tends to decline on its own. So it's generally not like a long time usage for kids.
Yeah.
Thankfully. And then we have, can you tell us something about the stability of the formulation?
Yeah, we have demonstrated the stability of the Scia Pro formulation for at least 36 months. We do that by looking at the plant compound concentration over time, the microbiology and other parameters. And the ingredient by itself has a shelf life of 24 months if it's kept in the closed original packaging.
Yes, and then we have another question. Is the CO8 active ingredient concentration always the same in each production? So yes, right now, and since and this was actually a part of the grant from the European Union to actually standardize the CO8, the active ingredient, in all our production lots. So right now, yes, our method today is to standardize the content of Scia Pro to CO8. It's about 2 to 3 times compared to the, like 10 years ago, it was only 100 milligrams of extract. So it varied a little bit. So right now we have about 2 to 3 times more of CO8 per dose, but it's always the same. So it's standardized, yes. And is there any minimum necessary to see an effect? So what we are doing right now is, and if we just compare it to the lot that was used in the clinical study in 2012, we have 3 times more CO8 in the current clinical trial and in our current manufacturing batches than we had in the prior clinical trials. And we've had actually really good feedback about the new manufacturing, or the new method that we use to standardize. So I would say that we are good on the CO8 content in Scia Pro today, absolutely, because we've seen an effect in a clinical trial in a lesser dose than we have right now.
Yeah. Now there's one regarding the webinar itself. I had trouble watching the webinar. Will I be able to watch the whole webinar after this session? We are going to make this available to watch later, so we'll be in touch with you and tell you how to download or watch it again.
So that's about it for questions. I hope you enjoyed this webinar, and please contact us, me, Lilja at Saganathura.com, or Páll, Pall at Saganathura.com, and we would be happy also to take your call. Thank you so much for staying with us today.
Thank you. Goodbye.